Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize ti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Nibo bofirirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito bataako.
Tubateeko tuli kujja mu kulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana dinedo kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card. Mudikola.
Ncheno naba akole ne ya.
Nedo debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu. Ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ikop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
The short and big shot.
Omumwa gonfukidde omumwa Zubeida. Kando night ogimanyi. Bagita kando night gwokutte gwobba.
Bawa wa sugar teyamazanye ku live.
Vamo jechiri. Vamo.
Bendera ddala.
Omusajja ate nga anakuswaza ajja kwana black sugar.
Abasajja munyiganga tebabati.
Noyingira n'atakubuuza. Ekibonyaabonya ababoda abasinga. Financial literacy. Oli abeera n'etaano ate nagenda n'akwanamu. Agala mutabani wange wakati w'emyaka alina okubanga ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kye nayagala ku ttiimu ya Mama Fiina.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Hey yo, what's up my people? This is the baddest Azari right here on Executive Media with RealTime with Mimi. Stay locked in. Yeah.
Our topic is about labor time. Natugenda okuzaala. Twetaaga ki? Do we need counseling before going to labor? Biki bye twetaaga nga tugenda mu labor? Biki bye tukola? Ebisinga obungi nga si bituufu before going to labor. So olwaleero ngenda kubuuza Dr. ebibuuzo ebyanga about labor time, and he's also going to explain to us biki bye tutamanya ndi biki bye twetaaga before going to labor. Because most of the women naddala ffe Abaganda, we think we have a connection with labor. Tulowooza tulina Oluganda n'Okuzaala.
Okay.
Yes, because since we have those old women
in the villages, yes.
They give us herbal
Medicines.
They advise when you're going to labor. There are some local medicine that they give mothers. They tell them when you're due, when you see that contractions, please take this.
Okay.
So the doctors are seeing a lot of pain with the mother. They are asking themselves, why are you getting all this pain? Baba tebogera.
Okay.
Because they know doctors don't advise
to use
to use it. So mostly we keep quiet, not until we get problems. There we can say, Dr. Namize nanywedde akadagala nyangwirizibwa okubanga nkola ki nganzaala. So there is misinformation about labor. So doctor, do we need counseling before labor? Like in the weeks zange natila, like 1 week, do I need to come to you as my gyno to get counseling to know what I'm supposed to do? Is it about only first mothers or every mother who's going to labor?
Okay. So labor is a process that results into delivering.
Yes.
Okay? So it's not an event into what and sekati the baby comes out.
Yes.
It is a process that takes a bit of time. Okay? For all pregnant women, the target is for them to reach 37 weeks.
Yes.
All right? Because from 37 weeks to, we know from 37 weeks, umwana aberanga kuze. Before 37 weeks, actually premature. Okay, so anyone who you've had premature, which takes anti yazara before 37 weeks. 37 weeks, baby akuze. So your preparation should occur before you have reached 37 weeks. Many a times, tulowooza labor is just a walk in the park. Genda n'ebintu byange, labor, then I walk back. Get it? Yes. And many a times, with
subira buli omu ali bulungi kamera nkira
akulindemu omuntu bw'aba akola mulinde
abadde ogamba ki wamma tuze bulungi muli bulungi. It's the health chat with Dr. Eladu, Dr. waffe. So olunaku lubeera lwakubiri tubeerawo wano eno okubaweereza, tubeera ku TMR hospital enaalya. Njagala okubategeeza bwe nadde bambuza ku bad black, she's okay. Yaŋŋambye agenda kubanga abayiwamu obufaananyi anytime from now. Mulabe Kawato Westline yazze. Dr. Martin yamukozeeko bulungi nnyo era nsuubira kati ababadde bagamba Uganda tebakola cosmetic surgeries, TMR ekola cosmetic surgery. Buli kimu, tummy tuck, lipo, BBL, ennyindo, dimples. Yes. So munagana buganyi kunyuma. Hips don't lie. So Dr. Eladu gyno waffe. Tumubuuza wano ebintu ebikwatagana n'ebyo byonna kuzaala, infections, lwaki sizaala, lwaki nsesema nga ndi lubuto, byonna buli kibuuzo kyo ky'obeera ng'ate weetaaze. So olunaku olwaleero it's a different day. Twagala kubeera ng'ate tusomako ku comments zammwe na biki bye muba mwagala dokita abaddiremu. Era olwaleero njagala dokita addemuuko ebibuuzo by'abantu wano nga 5 kitumubuuza ng'akiddamu. Njagala ntandike wano doctor. Good morning, doctor.
Good morning.
How are you?
I'm fine, thank you. How are you?
You're trending.
Am I?
Yes. Tebakutawanya in your inbox? They have not yet.
The people who manage the account haven't. I'm joking. I see the comments.
Bada mind doctor tukuweereza bu message bwaffe mu DM notabulaba. So doctor, I have comments here. So today I wanted you to first reply to these people who follow us on the health chat. Obaddemuko. So I have Naha Shani. She's saying, thanks for the show, but I'm having a question. But the question is in Luganda English. About Okuzaala Akanyama when they are carrying out a cancer test. My mother has a belief that when they do that test, even if you don't have cancer results, come out positive. I want to be highlighted more about that, and I'll be glad if they respond. And I also have the same belief.
But if they
Yes, even if you don't have cancer, there and then you will get cancer.
so
Okay, so doctor, even we have the same belief. Era I'm one of those people abati okugenda okukola test y'okunzijako akanyama.
okay. So cancer is a disease of time. Era cancer erina stages. Waliwo okuva stage 1 paka stage 4. The first 2 stages as a cancer are usually treatable and curable. Yes. Naye oba otuuse stage 3 and stage 4. Awo ekitegeeza nti cancer etambuddemu. Either it has left this place it was and it has gone to the nearby parts.
It is circulating.
Oba stage 4 mostly means that it has gone to far parts of the body. So it's easy to control cancer ngeri ku stage 1 because cancer kyali awo where the swelling is. Oba stage 2 nga it's just in the neighbors. So bwe batukebera cancer, the best confirmatory test ya cancer eri kanyama. Kitegedde. Ne kugundi ku breast. Oba olina akazimba. Teri test esobola kulaga nti olina cancer okuggyako akanyama. Waliwo obutest gye tukola mu musaayi. For example, cancer wa ovary. Oyo nedda amagi. Cancer wa ovary. Where the eggs are stored. Nayo gundi waliwo cancer in that area. It can form in that area. Waliwo cancer mu nabaana munda. Waliwo cancer wa omumwa gwa nabaana. Nedda. Any part of your body is all forming a cancer. Because what cancer means is the cells have started to overgrow. So, there are few cancers where we can use omusaayi. Ga cancer wa ovaries awo tujamu omusaayi ne tutwala mu laabu ne tukebera. Okay? Then there are things that those cancers, the chemicals that those cancers produce. Kati if you see there's levels of those chemicals ziri waggulu nnyo mu musaayi awo ne tusasa waliwo cancer. Ne cancer w'omusaayi leukemia. Oyo tujjemu omusaayi ne tukebera. If we see the cells are so many, tusobola kugamba nti oyo ayina cancer w'omusaayi. Naye majority of cancers tulina okonfaminga n'akanyama. The problem is beera nti abantu bangi bajja ku ddwaliro nga obudde kituufu.
That fear, doctor. No one comes out to talk about it. That please, you can do those tests.
Kati tuzyogera. We are speaking about it now. That's why we are saying. I told you that cancer wanabaana, cancer of the cervix, etwala 10 to 15 years to form from the time the changes start. That's why tugamba nti mugende mukebere every 3 to 5 years. Because if you check early, high chances is ofunanga tenabafuka cancer, and that place can be treated awonowona. The same thing happens with ebizimba. If you have any swelling on the body, don't sit there and you wait for pain to come. Tulinda pain. Unlike people in developed countries, buli mwaka bagenda for check-up. Nabo babeera ne cancer, but theirs is not because it has been diagnosed late. Ours tufa nnyo lwakuba tugenda ku ddwaliro late. That's why by the time someone goes, cancer agenze mu stage 3 or stage 4. And that's why by the time we check, it means that there is not much we can do to stop that cancer. Of course, we also have obujanjabi to reduce the burden of the cancer, to add you some years. Naye the cancer has already affected other organs. So my advice usually, and to our listeners, is that when you have something that doesn't make sense, akazimba, could be on the hand, could be on the breast, could be on the neck, go and have it checked. If the doctor suggests to collect test gundi to tujijeyo akanyama, do that test. Because the earlier you do it, the better. Sobola kusanga nga cancer tena bakola ki? Then we can give you the right treatment or not. But if you wait for pain, many people wait for pain. By the time bafuna pain, tebawulira bulungi, it means that cancer has gone. It humbled.
So, Doctor, waliwo akanyama ko bakajjawo bati ne watana.
Awo, kitegeza ki?
Like the place gets infected.
No. But you see, again also it's good to go to the right people. Kubanga, I have seen one time I saw a patient. Abada inawa gondi a swelling mubere. Nagenda to some place. Simbanyi where she went. And the person suggested we remove that swelling before confirming is no cancer or cancer. So when you remove cancer wrongly, kubanga okujamu cancer, you have to remove it completely so that nga tewali margin esigadde esobola kukumawo. So that is the biggest problem. Sometimes people go to the wrong places. They look for shortcuts. They don't remove the cancer well. So the area, as long as you disturb that cancer area, that means that it can easily spread to the blood and it can affect the body. So that's why maybe that area can sort of, so that person comes to hospital within a few months, they try to remove it. Now the whole breast is swollen. The cancer has spread to the breast, and you find that is too late. So go to the right people, go to the right places.
Maybe sometimes it's also about panic. Cancer is a doctor.
Stufu, cancer is very scary. It's very deadly, more than even the HIVs and all that. You get it. But for cancer, there is cure if you test early. Test early, screen early. There are cancers that we ask you to screen every 3 years, like cancer of the cervix. It can be prevented.
What about this one?
The cancer of the breast, if you have family history, inti family bafunako cancer of the breast, there are some tests that we do mumsai and even in the genes. We see if you have a risk of getting cancer. You've heard of actresses Angelina Jolie.
Yes.
Abada ina cancer mu family. So what she did, she just removed the breasts. And when you remove that, the breast tissue, you find that your chance of getting that cancer is very minimal. You get it?
Bwemanya nti mu family yange baso mulimo omuntu yali afuna
yes. Yeah. So sometimes there of course there's what they call a risk profile. They can find out if you are at a high risk of getting that cancer. If they find out that you're at a high risk, you better prevent it before it forms. So they will advise you.
So doctors can find it out.
Yeah, there are tests that can be done.
So doctor ndozo obuzibu bwaffe
tutya, but
tumutya nnyo doctor.
And indeed, we should fear, but that fear should be translated with the screening.
Yes.
My parents and aunties, I drag them every year. I tell them to get to collect screening.
You like it or not?
Yeah, because you see, you rather find it early and finding it late. It's easier to treat than when you come on stage 4 and there's nothing we can most likely do.
Okay. So topic leero si ya cancer, just ekibadde kibuuzo. Thanks Mimi for this educative interview on Bamitani Bilabwa Kathy. So educative, I need to go to this doctor because most hospitals I've been going to, it seems tebamanyi bakola. Ruth Agamba, my question is, doctor, can infections also cause mouth smell? Oh, because when I was still married, the man used to smell from his breath. And when we used to feel it, when they had sex, she used to feel itching and feeling pain during urinating.
Okay. Can infections cause mouth smell? That's a good one, because it depends on there can be infections or dental cavities in the mouth. But if she's referring to urine infections, because I think that's what she's referring to, it now goes back to the type of intercourse. Okay? Yes. So sometimes the oral sexual intercourse and all that can definitely predispose you to some of these infections. For example, if someone has herpes in their genitalia and then you do the oral sex, it's possible that you can also get herpes in the mouth. You get it? Yeah. But it really requires a lot of poor hygiene from that person who does not brush the teeth and clean the mouth, and for that those infections to actually cause a bad smell and cause mouth infections. You get it? It's also possible that if someone has herpes in the mouth, when they do the oral sex, they can easily transfer the herpes on the genital area of the person. So it means that oral sex is risky. And you should be very certain about really the health of this person and all that. Otherwise, it can still be able to transmit infection. So you may find that this person can transmit infections to you in your genitalia, and then you start feeling some of those symptoms.
Okay. So the urinary infections cannot cause bad breath unless otherwise.
It's not a very common thing. Okay. Yeah.
So Mbabazi is saying, thanks Shami for hosting. Doctor, we really learn a lot from his conversations. Thank you, Shami and Doctor at large. Ndowooza ebibuuzo byompadde mukama wange producer. Asimwe process asking, are those who don't get any discharge in their vaginas, is it normal, doctor?
Abnormal discharge or normal discharge? Kubanga.
Like any discharge, abnormal, normal, because like the vagina isn't producing any discharge.
Yes.
Like she's asking, is it normal?
People have got different levels of lubrication. Okay? The normal vagina has got glands that are supposed to produce mucus secretions. Some of the secretions also come from the cervix or from the womb. You get it? So it really depends on also the hormonal changes that the person is going through. If someone is really having a lot of stress and the hormone control or the balance is not good, it's possible for the discharge to be affected. Now, there are people who are naturally not having enough lubrication, and it's a normal thing. You get it? Yes, it's a normal thing because we are different.
So they shouldn't worry.
They shouldn't worry, but there are so many things that they can use out there, the lubricants and all that, to help them maybe feel much better, especially to avoid a bit of bruises and all that during sexual intercourse.
Are those lubricants good, doctor?
Yes.
Those bought in pharmacies?
Yes. That you have
cannot cause cancer?
No, they shouldn't cause cancer.
People fear lubricants.
Yeah, but
because like you the same doctors say no one should insert anything in that place.
There are specific lubricants that are recommended.
Oh, they should recommend.
Yeah. There are specific lubricants, especially there are those that are water soluble lubricants that have the composition of water. You get it? So those don't change the vaginal environment and acidity. Yeah. So if you get different lubricants, then they can easily also cause you discomfort. Yeah.
Okay. So Dr. Agambye osobola okukozesa lubricants naye ng'ogenze wa Dr. n'omunnyonnyola. Dr. Eladu kye tumuyigiddeko agamba nnyo nti buli kyofuna gende wa Dr. omunnyonnyole tomutya nnyonnyola gayinowo omugambe am experiencing this and this. Definitely ajja kurecommendinga ku kintu ekyo ekirungi ekijja mu bulamu bwo nga tekigenda kwafa.
In fact, also for the dryness, it can sometimes come and go. The person has transitioned into menopause. Okay, or nearing that transition, or because you may have a bit of dryness because of the reduction in the hormones. So for those ones, we can give them creams, the creams that contain some hormones, estrogen, that they can apply, and that can improve on the lubrication of the vagina. So it's very important to know what really is causing this
Anti waliwo n'abali ku family planning, doctor.
Yeah. But
family planning
ngachi
eleta nga tebakyafuna discharge yonna. Women are driving.
With the family
planning is too bad.
So the family planning has its benefits. No, but you see, I think there's a lot of misinformation on family planning. But even before you get a family planning, the person giving you the family planning should advise you, should counsel you. The problem is to get family planning, and then you get and you go. But the right way is you're supposed to have someone explain to you. In family planning, when you get, it's going to cause, for example, the hormones. If you get the hormones, it might make you put on some weight. It might cause you to have irregular bleeding pattern. Some will have little bleeding, others will have no bleeding, others will have heavy bleeding. It might reduce your mood for sexual intercourse. You get it? Yeah. But also you realize that with some of the hormones, because the vaginal lubrication depends on the hormones. So if you're using a hormonal method, it means it may disorganize that a bit, and so it may cause some of that. You get it? So before getting family planning, have a proper conversation. Ask them, what are the benefits? What are the likely risks if I use this family planning? No, but whoever is giving you the family planning is trained. Or the midwife. They are usually trained to explain these things, so that when you see them, you're not anxious, you're not scared. You get it? And not every family planning works for everyone. For you can use mpiso or sobola kozesa implant nga you have no problem.
Yes.
Naye omulala asobola kozesa the same family planning nafuna issues oba nabeera nga they are not the body is not okay with it.
We shall get a full topic about family planning because even some women go for family planning IUD, the IUD, and then they get pregnant.
We will have a discussion on family proper discussion.
My sister suffered with IUD. We are planning for IUD. We went for the IUD. Then she got pregnant.
Okay, so finally on family planning, there is no family planning that is 100%. Era family planning, yes, okujako abstinence. Even tying the tubes is not 100%. Even a kaweta is not 100%. Even the hormones are not 100%. It's only abstinence.
Family planning and you get pregnant. Even an implant.
But you see, the rate of conceiving in family planning is less than someone who doesn't have family planning. You get it? Most of these family planning options they protect you about 98 to 99%. You get effectiveness. Okay? So even cutting the tubes, because I've had patients whose tubes were cut, they had 4 C-sections or 5 C-sections, never saw tubes, then they come back pregnant. Some tubes can reconnect. Katonda ndoza. So, theory family planning is 100%, but your doctor or midwife should be able to explain to you this one. There are things that you do that can make the family planning less effective. Okay, there's some drugs and all that you take. Yeah, we shall have a session on it. So, if sometimes if the kaweta is not in the right position, if the kaweta has moved,
it has caused the problems. Too much infections, pregnancy, insecticide.
It's okay.
We shall talk
we shall have a session.
Because today our topic is about labor time. Natugenda Okuzaala. Twetaaga ki? Do we need counseling before going to labor? Biki bye twetaaga nga tugenda mu labor? Biki bye tukola? Ebisinga obungi nga si bituufu before going to labor. So olwaleero ngenda kubuuza Dr. ebibuuzo ebyanga about labor time, and he's also going to explain to us biki bye tutamanya and biki bye twetaaga before going to labor. Because most of the women naddala ffe Abaganda, we think we have a connection with labor. Tulowooza tulina Oluganda ne Okuzaala.
Okay.
Yes, because since we have those old women the
villages, yes.
They give us herbal
Medicines.
They advise when you're going to labor. There are some local medicine that they give mothers. They tell them when you're due, when you see that contractions, please take this.
Okay.
So the doctors are seeing a lot of pain with the mother. They are asking themselves, why are you getting all this pain? Baba tebogera.
Okay.
Because they know doctors don't advise
to use.
to use it. So mostly we keep quiet. Not until we get problems. There we can say, Dr. Namize nanywedde akadagala nyangwirizibwa okubanga nkola ki nanzaala. So there is misinformation about labor. So doctor, do we need counseling before labor? Like in the weeks zange natila, like 1 week, do I need to come to you as my gyno to get counseling to know what I'm supposed to do? Is it about only first mothers or every mother who's going to labor?
Okay. So labor is a process that results into delivering.
Yes.
Okay? So it's not an event until what time second the baby comes out.
Yes.
It is a process that takes a bit of time. Okay? For all pregnant women, the target is for them to reach 37 weeks.
Yes.
All right? Because from 37 weeks to, we know from 37 weeks, umwana aberanga kuze. Before 37 weeks, akyali premature. Okay, so anyone who you've had premature, which takes until yazala before 37 weeks. 37 weeks, baby akuze. So your preparation should occur before you have reached 37 weeks. Many a times, tulowooza labor is just a walk in the park. Genda n'ebintu byange, labor, then I walk back. Get it? Yes. And many a times, we think that everyone who is pregnant should push. You get it? Yeah. So it's a common conception or misconception. But there is a lot that happens in labor that is unique for each person.
Okay.
Number one is that you should be able to tell the signs of labor. In fact, before I answer that, so do women need counseling? Not just women. Does the couple need counseling?
Why?
About labor?
Why are you saying the couple?
Because we have seen it in hospital that every time the wife comes to antenatal, we teach the wife, we teach the woman, we tell them these things. And the men go to the bars and talk with their friends. And they will listen to what their friends have told them. You get it? Then the same husbands will be the ones to dictate what happens to the woman.
Yes.
You get it? So we need to have both of them so that we are able to educate them and make sure they have the same knowledge. Kubanga, if this woman comes to hospital and we teach her, when the husband asks, Dr. Emma yagamba chirero, she's not able to explain everything. So she will just give a brief answer and fine. Take it. So that is a missed opportunity for that husband to learn enough information about labor and what can happen, what can go wrong, what should be done. So the couple definitely needs counseling. And I emphasize the couple before labor. I emphasize the couple because the two are going to be responsible for the baby that is going to be delivered. If anything happens to that baby, the two of you are going to feel more impact than another person. You get it? Yes. So if you find that some people come to hospital with their friends, which is okay, but that friend will tell you when you're giving birth, I also advise tokkiriza what they're telling you.
Yes.
Balimba, bagala sente. Kakati, when something happens to your baby, do you think that friend will feel the impact compared to you? Not likely. If you get
they're going to blame the hospital.
If you get a poor outcome, nga she told you don't accept what the Musao is going to do. You are the one who's going to be stuck with your baby. If the baby has problems, or against the or aina cerebral palsy, aina special needs, you are the one who is going to have that effect of the baby. Or again to their home, to her husband and to the... So you are the one who's going to suffer the burden. Take it. So it's very important that when you come to hospital, come with that husband or your partner or someone who is going to really understand to ask the right questions. Next of kin. So that when you're deciding from an informed point of view. So it's very important to counsel. So what is labor? It's a process. Number two, women should know that labor has symptoms, or it has things you can see. The process okay? There are commonly three basic signs of labor. One is pain. Okay? The pain should increase in intensity and frequency. When labor pains start, labor taina reverse gear. Into a say, then after it disappears, no mura, no genda, no nywa chai. It can reduce.
Before nkugamba doctor ebisaba innuma then nonkeberako noga wait then after nogamba tebadde time ya labor.
So what it means is that your doctor should be able to determine properly that your labor started or not, because not every pain is labor pain. Take it. But usually labor pain, when it starts, it keeps on increasing progressively and take a reverse, and it becomes very intense in kumpi kuzaala. And when the baby is out, the pains go away. All right? So number two is what we call a mucus plug. So there is usually something that covers the cervix. There's a mucus that covers the cervix to prevent whatever is in the baby to come out and vice versa, whatever is outside to get into the baby. Now, whatever process at hand, that cervix begins to open and the mucus comes out. Okay? So that is what we call a mucus plug. And sometimes it's slippery, mucus with blood. Yes. Okay? Then the third one is water breaking. All right? So when the water breaks, that is a sign that your process has started. So you should be able to know these signs. Now, other people have different signs. There are others who want to be in the toilet. No, it's
also a sign.
Yeah, it can be, but the other first three are the commonest sign. And your doctor is going to ask you, what have you seen? Okay? Yeah, so when the signs are present, then it's important to be in hospital. Because mudwaliro, we do one thing, we monitor. Twagala kumonitoringa mama ne mwana. The mother, we monitor the pain. So if we realize the pain is getting weak, so that can increase the pain. Because without pain, without contractions, that baby cannot go down. Okay? So we need the contractions. If they're getting weaker, we can give you medicine and it increases the contractions. But they keep on increasing until that baby is out. Number two, we monitor the cervix of the mother. Okay? So for those who maybe first-time mothers and all that, Okuzaala, for you to push the baby, the cervix must open from 0 centimeters until 10 centimeters. So it's... So you must reach 10 centimeters. If you are 4 centimeters, you're 6 centimeters, there you can't push that baby. Okay? So you know, took a 10, because 10 centimeters is what allows the head of the baby to go through the cervix. The head of the baby is the biggest part of the body. So if the head can go through, the rest of the body can go through. So we monitor the contractions and the cervix, and we can keep on updating you. For the baby, we monitor the heartbeat. You know, we're normal. The normal range is 120 to 160. Kakati, wa mama tuse mudwaliro, netukebera, and we find that aina contractions nungi, cervix etandise okwegula, mwana ali okay. Oyo mama tumuwa obudde asobola sindika. Paka nga atuse 10 centimeters, kasitanga mwana kyali okay, awo ne tugamba kale sindika. So you should not be pushing nga tonaba tuka 10 centimeters. If you start pushing at 4 centimeters, cervix zimba, we stop labor. If you also push before 10 centimeters, mwana yenzo kumkoa.
I was going to ask you about that. After a mother passing through all the pain, after you say agenda kuchiso.
Kale. Kanchidemu. labor elinganga exercise or marathon. We all have different endurance.
Yes.
So waliwo bakolaki? There are those who can endure a 42-kilometer marathon.
Yes.
Ne waliwo asobola just 10 kilometers. Sicho. So that is how the endurance is different for each person. Ne mwana weba mama ali mu labor, the baby ali mu exercise, ali mu endurance. So for us as basawo, we monitor the endurance of the baby by monitoring the heartbeat of the baby. Kasitanga eri between 120 to 160, which takes nti akyali fine. If it goes above 160, then we say, ngono mwana atandise mukoowa. Below 120, so in fact we use the heartbeat to say nti mwana akooye oba akyali fine. So that is the endurance that happens. The endurance can happen for the mother. Some mothers get tired. Yeah. Some mothers reach 4 or 5 centimeters and she can't breathe.
The pain is too much.
The pain is too much and all that, but that does not mean that we are going to operate her. Sometimes we try to help the mother. Glucose, take some tea and all that to build that energy and momentum so that we can reach 10 centimeters. So if the mother is okay, atambula bulungi, if the baby is okay, nga tutuka 10 centimeters, that is when we say kale tusindike baby. So the pushing does not happen before 10 centimeters.
Then doctor eatinga Owuliranga go kintu kikugamba.
Tufu.
Then the doctor is saying
Don't.
push.
That is why during the antenatals, we take you through training. They are what we call breathing exercises. If you're feeling contractions, there are things you can do to bear the contraction and not necessarily to push. Because if you start pushing before the time is right, you are putting yourself under stress, you're putting that baby under stress, and the success is going to be reduced.
So doctor, omwana okukowa si contribution yamwe ng'abasawo kuba ogambye you monitor the mother, you monitor the heartbeat of the baby. Kati ate bwe mumala ne mugamba omuzadde mother oba next of kin tugenda ku kiso omwana akooye. Some mothers say omwana akooye abaana bafuna cerebral palsy ng'abadde tazirina. But in labor wazifunira obusibu gayavu bwa doctor abandiko gaino wana.
So because I know, of course, when such a thing happens, we want to look for blame. Okay? Yes. So it's a normal thing. You want to get an explanation. Now, me, I'll be honest with you that the most important part of the labor is the monitoring. Which take it. Okay. So, and sometimes I want to teach my patients to reach a point in nabo balinganga basawo. They know what is happening. You get it? Because sometimes tusobola ku monitoring ne tusanga nti mama ali 4 centimeters or 5 centimeters. Naye omutima gwa baby guli waggulu nnyo. Eri 170, 180. Of course, with first aid, or there is an intervention before operation. To take a drip. Sometimes we put the mother on oxygen. Sometimes we give you some glucose to see if the baby can become fine. Now, if after 1 or 2 hours, or it is now below 120, that is a sign that that baby is not okay. You need to deliver that baby in a short while.
So the baby is not okay. Fine for that.
Nantikati ulira endurance. You may find that the baby was able to handle the first 5 hours of the labor. But after that, ngakoye genuinely. And the tiredness may not be because of the mother, may just be because that the baby can no longer handle the contractions. Nedda, if the intervention is done early, so the role of the doctor is to, or the midwife, is to identify into mwana ali okay or batali okay. And if that has happened, your doctor or midwife is supposed to cancel you nakugamba nti mkwano tukoze kino nekino naye baby omutima gukyali waggulu. Kati the next step is twinomuzaala by C-section. So that is where usually the delay comes from. Either we delay to intervene to call C-section, or the patient can refuse. There are many times I tell patients, mwana wakoye nagamba nedda.
But I will see what Jiramunga doctor no, if you either refuse or nedda tugenda kusala.
Nantikati ulira. This is a person who has rights. In hospital, the role of the doctor is not to force you. To forcing abantu for operation nedda. Era we advise, we tell you ABC, this is the risk ABCD. From my experience, if we do this at this time, we are likely to get a good outcome. Now that is the time it's very important for us to be able to listen to each other. Because if I tell you that there's a risk, we need to do a C-section. I will know Ghana. Or maybe your husband says, Neda mu family wa fete wali muntu that who has been operated, or by your next of kin, mama. If you make that delay, it means that whatever time you're wasting is going to affecting the baby. You get it, eh? So it's very important that you are monitored well. And usually we monitor you at intervals. If the baby is not fine, if the heart is high, we monitor even in a shorter interval. Every 10, 15 minutes, if we see njawulo, and within 30 to 1 hour, we have decided in Tineda, ochali 4 centimeters, you're going to take another 6 hours to make it to 10 centimeters. By that 6 hours, baby would have died. Actually, tukoleche tuzaale baby.
Tebalina we bakeberera mutima gwa mwana. Tebalina we bakolera ki? Simanyi kiddako.
So it's very important. So in part of the counseling that we do nga tuli kumpi kuzaala, there's what we call birth preparedness. People who are not prepared to give birth end up getting poor outcomes. Part of the birth preparedness is, where are you going to give birth from?
Yes.
If over on the clinic, find out from that clinic, here, what do you do? Can you monitor me or my baby? If I have a problem, what is the next step? Muina theater, what a muina theater. Muina ambulance, what a muina ambulance. Muina nursery, what a muina nursery. So where you give birth from is your choice. You are the one who chooses that place. So when you're preparing to give birth before 37 weeks, go and see the place. Well, some people do antenatals from other places, never gained somewhere else, which is okay. But do you know where you're going to? Well, because mukwano go yazara ko mu clinic at yawo, now you also think that is the right place for you. So go and see the place. Not true, but you see, like I told you, labor gives you time. For example, the first time mother, between 16 to 24 hours in labor. So it means also you can travel from Mukono to Kampala.
Yes.
And reach your hospital. Problem is, many people underestimate labor. So say that is the time they want to go shopping mu kibuga. So that is all time you're wasting. You get it? Some people feel pain, never. By the time you jump in the car, you're pushing. So it's very important to know where are you going to give birth from, so that you know it takes me 2 hours. Namugongo. I know that from Namugongo to TMR is 1 hour. So if I start feeling pains, I can say, Neda, what will jam on that road? Let me start going early so that I reach in hospital early. So that's all part of planning. How to reach hospital? Who is going to take care of you in hospital? The costs. Most times we don't plan for giving birth. By the time we are going to give birth, that's when we remember, hey. So when they tell you into operation, that's the time you think of money. Nice, operation ya make 1.5 million is a sentence. Then that's the time you now start fighting. Nedda, don't operate me in the Sagara operation because just say So you need to plan early so that you know that wano TMR C-section this amount of money. Do I have that money? If I don't have that money, which other place can I go and give birth from, which can accept or which has the package for my money? If you don't have money, you can say, can I go to the National Hospital? You don't pay the money. Of course, there may be a few issues, but you take it. So don't go to a place when you don't know information about it. Because that is a mistake people make.
So, doctor, do you make money in C-section? These days, percentage 100, 80% of abakazi.
No.
You advise them. You no longer advise women until you can push. Buliaja na booking appointment. Nga mumusala ne bwaba asobola okusindika. Wagamba nze nako wakati by'okusindika saagala yadde okugezaako mwateekawo nekinombu you can control the contractions n'atawulira yadde ka pain.
Yes, epidural.
Ye n'alaba bulabi mwana. So are you advising women oba mwongedde boonoonyi kubeeranga because women have money?
Okay, so let me answer the second part first.
Yes, you're making money through C-section.
Neda's better, but I'll come to that. So one, right now, where we have reached as a country and as a profession, we can give you medicine to take away the pain. Yet we have epidural. Sometimes people are afraid of labor because of pain. They think, I cannot handle the pain, Rumi. So meaning that if you are given that option of an epidural, you are more willing to actually go through the labor process. That's why the epidural exists, to give women chances and confidence to go through labor so that they can push their babies. So the epidural is there. Well, in a sentence, you plan for an epidural if you are someone who fears the pain. Okay? There is no joy in suffering. You can't, you are suffering all through.
The joy of having a baby.
Really? The baby is still, you've carried the baby for 9 months. So is it the pain? So you see, for you, the pains maybe, but there's someone there who fears. I get so many patients who come and request for C-sections, but I don't give it to them. You get it? So,
advise them.
Yes.
Not a color scent.
Neither C-scent. But you see, the honest truth is this. Normal vaginal birth is better than C-section. At any time, any day. Kastanga, everything is okay. So, and worldwide, there are more women giving birth vaginally than C-sections.
But not here.
Not where?
In Uganda.
No, even in Uganda. It's just that for us, we are concentrated in Kampala. You get it? And we have so many elites who think they don't want. So the advantages of normal vaginal birth outweigh those of C-section. You spend a short time mu ddwaliro, owona mangu, ne sente si nyingi, ziba ntono. And you recover within a short while and you can have as many children as you want. So a properly trained doctor should be able to really explain these things to you. C-section, on the other side, should be reserved for people who cannot push or who have failed to push. Now, we can determine during antenatal intigwe or inner risks, tosobola kusindika, and your doctor should be able to explain to you nti amagumba go gali tight gafunda. So that means that even if you labored for 2 days, you may not push. So it's pointless for you to go through that process nga togenda kusindika. Sometimes I explain to the patients, and they say themselves, can I at least try? Which is fine. I give you to try. Walk all year, together for C-section. But it comes when I've informed you and your bones are not okay. Number two, there are people whose babies may be big.
Yes.
One ali kilo 5, 6, 4.8. Chitufu, but the risks of pushing are more than those of not pushing. You can easily get a very bad tear at sobola tuka paka ku rectum. Awonofuna fistula and all those complications. So as a doctor, I will advise you and say, no, because of the size of the baby and your bones, this baby may not be able to pass. It would be safer to call a C-section. All right? But as a doctor, I stop at advising. I don't force. And that is the emphasis, that everyone who is out there, don't be forced into C-section. Your doctor should be able to counsel and advise you about the benefits of what is going to be done. All right? There are people who have heart issues that pushing may make them worse. So you advise them, nogamba nedda, because of your ABCD, tugende tukoleche tukulongose. There are people who have already been operated 2 times.
When I'm operated 2 times, I'm not allowed
2
to
times
push.
and above, it is dangerous for you to push. Okay? Because jukira labor etwala budde. So as the contractions are coming, cervix is taking long to reach 10 centimeters. Where you had the cut can easily open. No funachi, rupture, wana kukoyabika. So those are some of the risks. So your doctor should be able to advise you. So that person, we plan and do a C-section early. Then there are people we monitor muleba nakugambe. We monitor from 0 to 10 centimeters, baby and all that. If we find out in the wakati muleba, your process attend, say naikati mwana tali fine. Do we leave you to go through the labor because you've been suffering in labor? Nedda. We advise netugamba nedda mkwano mwana wafe akoye. Let us deliver this baby before we get problems. Kati gwe asala.
So it's my decision.
It is your decision as a patient and your next of kin. No one should force you. And someone should have a clear reason for the C-section. Because sometimes I ask mothers, lwaki bakulongose? Nga tamanyi. Gamba nali ku ddwaliro ne bagamba tugende. No, you need to have someone has to give you a good reason. ABCD, baby is not fine, or ABCD is happening to you. This is the safest way of giving birth. So, because you see, C-section is going to be costly. You get it? Even if much as normal delivery is costly, C-section is going to be more costly because they will take you to theatre. Waliwo theatre fees, waliwo professional fees ez'omusawo agenda kulongosa, waliwo fees eza nursing ogenda kusiba mu ddwaliro ennaku 3. That is all an expense. Okay? So, and you see, ideally, the doctors, the cost of C-section versus normal delivery, most hospitals, the doctors almost get the same amount. If anything, normal delivery is much better. Now, are there doctors who operate people to get money? Yes. Wherever But as a patient, make sure that you ask the right questions. And if you're not contented, tell the doctor, njagala funa second opinion. And it is normal. Go to another place. You can go to a government hospital and say, based on my risks, nsobola kusindika. Get it, eh? So no one should force you to a C-section. Okay? And you should be able to, your eyes should be open. Okay? Because most times people think we operate because we want the money.
Like hospitals like TMR, other hospitals in the same caliber. Bagamba musala busazi. Chikuru kya benezo sente ziba nyingi.
Let me tell you, at TMR we do 1 midwife to 1 patient in labor. Kitegeeza nti we give you enough time oyera ne musawo and you're laboring. We are not in a hurry. You get it, eh? We're not in a hurry. So we'll monitor you. We will only operate you. But also in most other hospitals, there are a few that might be operated. But I think most times people say that when they have not understood why they've been operated. Okay? So it's very important to understand why are you being operated. Okay? But also, people say that when the costs, they didn't plan. And usually I tell patients during the birth preparedness session, plan for the worst in labor.
Okay. Anything can happen.
Anything can happen. Even if you've pushed 4 children, you can still end up in a C-section. If your baby is tired, you can end up in a C-section. So plan for the worst, meaning if you're going to give birth at TMR, find out if I fail to push, sente za kusinika, I mean, za C-section maker. So that if you have that money, you are confident. Even if you push, osigala ne sente zo. You get it. Many times people plan only for normal delivery. Nafuna maybe 1 million for normal delivery, or nasikala. So now, what happens is that if you tell them you're going for C-section, they will not understand. You get it? So labor is dynamic. It changes for everyone and for each baby. The normal take is if you've pushed before, we would like for you to push because there is evidence that you've pushed before. Yeah?
So, Doctor, nsobola okusindika nga bansaze?
Yes. But the condition should be that you'd have only operated you mirindi gumu.
Yes, but bayinza okuba bansala last year.
Second condition is that you should take at least 1.5 years before getting pregnant from the last C-section. So if they have operated you this year, you need to take 1.5 years to get pregnant, not to give birth. Before we would say 2 years to get pregnant. Okay? So you need to take at least 1.5 years before, or about 2 years before you conceive, then you will be given an opportunity. Number 3, there should be no other risk. Tofunye pressure, toina sukari, you don't have any other complication. Okay, and then we prefer for your labor pains to come naturally.
So, Doctor, lwaki ennaku zino buli mwana azaalibwa abamutwala mu nursery? Is it also another plan of making money for hospitals? Like, because buli mwana ogenda okuwulira mama ali bulungi naye omwana ali mu nursery.
So,
and nursery is very expensive.
True.
I think it's also another way of hospitals making money.
So, there's what we call the neonatal death rate, or the number of babies who die after being delivered. Okay?
Yes.
we are trying to reduce that number. All right. The time labor and childbirth is a very sensitive period of time. Okay. And that we usually recommend that mothers. Sorry, I think. So the nursery is a special place for little babies. Before your baby is taken to a nursery, there's what we call admission criteria. Into one, can this baby benefit from nursery? The commonest conditions that take babies to nursery are kubanga tasa bulungi. So when we give birth to the baby, omusawo, the one who has received the baby, agenda ku assessing a mwana. Nalaba nti mwana asa bulungi oba tasa bulungi. Okay? And there are things that we do to determine that. We see how the chest is moving. We see how the nose is to measuring oxygen. You get it. So if that baby is not breathing fine, then that baby is going to benefit from a bit of support in nursery. And most times about tebalwayo nnyo mu nursery. And it also depends on how bad the difficulty in breathing is. Kubanga sometimes mwana tuyinza okusanga nti mwana ono mutima badde gukuba nnyo ng'ali mu labor. Ne tuzaala nga takaabye bulungi. But we stimulate the baby. Mabega, people used to slap and pinch, but these days we don't do that. Okay?
You don't pinch?
We don't pinch the babies. So musawa assessinga na if the baby is not crying well tasa bulungi, that baby is best ngali mu nursery. Naye oba akaabye bulungi, okay, asa bulungi, oxygen is fine, that baby should not be to the nursery. So number 2, infection. Okay?
Doctor, infection is
so mwana weba ali munda muna baana abeera nga ali mu mazzi sikyo, that water is supposed to be clean nga amazzi ga bulijjo. But oba mwana koye, if the baby is tired in the womb, akola pupu mu mazzi. Pupu ya baby ebeera usually yellow or green.
Yes.
Okay? The problem is if the baby is still munabana, that baby can still swallow that water, and that water can still enter mu mawugwe gwa mwana. So if that water that has pupu has entered in the lungs of the baby, it makes it difficult for that baby to breathe and afuna what we call meconium pneumonia. Pneumonia because that water has entered. So sometimes in some hospitals, they also assess that. If the water is dirty, it is safer to monitor that baby ku nursery. Pneumonia. So that's where the infection comes from, when the baby does the poo-poo. Or there's some mothers who come when the water is broken for a long time. Water broke 2 days ago. As long as that water breaks for longer than 6 to 12 hours, that water or in a chance of an infection, because the infection can go from the vagina and it can affect that baby. Okay, so those are babies who might also be monitored in the nursery. Premature babies, because premature babies suffer from 3 things: tebasobola kusaba bulungi, tebasobola kuyonka, breastfeeding bulungi, and their immune system is weak. So those ones, unless the baby is showing good signs, but most times sokera ku nursery wabali stable, then after, if the baby can suck bulungi, asa bulungi, then we bring back the baby to the mother. Very big babies, mwana bigger than 4.5 kilograms, sokera mu nursery, because that baby has been getting too much glucose from the mother. Kati now when you're going to breastfeed that baby, remember the first few days toina mabere. I mean, toina matter. The milk is not there in the breasts. So that baby is going to get low sugar levels. And those low sugar levels can cause convulsions or kwesika. Mwana. Okay? And if the baby starts convulsing, that can cause permanent brain damage, the cerebral palsy. There's a tugambye muko.
So Dr. Bana,
yes. Chisoboka. The baby is not breathing well. the baby is having convulsions, okay? So that baby who is big is first started from the nursery. To monitor so that the sugars can stabilize, the milk has come, then we give the baby back to the mother. Abaana bwe bafuna yellowing, kakamuli. The kamuli is not supposed to happen within the first 2 days of giving birth. Kamuli normally is because there are cells that are supposed to be broken after the baby has been delivered. That breaking of the cells happens after some time, usually 5, 6, 7 days. So the kamuli that happens later is not as harmful like the kamuli that happens within the first 2 days. So when the doctors check 1 day after giving birth, mwana ina kamuli, 2 days after, that is dangerous kamuli because nacho causing irreversible brain damage, asobola kuleta cerebral palsy. So when the doctors say, I check the baby ina kamuli, nursery. Then I want to call a phototherapy. When the kamuli has reduced, we give the baby back to you. So in other words, we want your baby to live long, want your baby to be healthy. Okay? It is very painful okubeera mu ddwaliro ne tusiibula, then you come back within a few days nti mwana tali fine. Wakiri tumukuume for some days, awone bulungi, then you go home and you start your life properly. So it's not money. But again, it goes to explanation. Sometimes we don't explain well.
Yes, you just say one against them
nursery. Then you start imagining, but you may find, you ask, why is the baby in nursery? Okay? Discuss with the person. Don't fear these doctors and midwives and nurses. And we are human beings, but we want, most important, for your baby to be fine.
Okay. So, doctor, I have 2 other questions.
Okay.
When am I supposed to be discharged on normal delivery to leave the hospital? Okay.
So
C-section.
So the first complications, the commonest complications after giving birth is bleeding.
Yes.
Era kyekisinga okuta abantu.
Is it the one called
PPH? You have tried. PPH is called postpartum hemorrhage. It means bleeding after giving birth. It is the leading cause of death in mothers. Why? Because if you're pregnant, there is a lot of blood that flows in the navana. And if you start bleeding, you can lose all that blood within 10 minutes. Yes, you can lose your blood volume. So bleeding after birth is a very serious complications of giving birth. It can happen after normal birth or even after C-section. Yes. Nedda, even C-section it can happen. So those bleeding after birth, infections, pressure during birth and after birth, those are the commonest complications that can happen. And those complications happen within the first 6 hours. 6 to 12 hours of giving birth, like the first 6 hours. So, standard is, if you have given birth normally, the hospital keeps you for about 12 to 24 hours. Most hospitals do 24 hours because they are sure by 24 hours, the complications are not as high as expected. Yes. So you some hospitals, of course, I know, maybe Kawempe and all that, maybe if the place is so full and I know some health center falls and all that, if they are
but now Baba Beza for almost 6 hours.
Yeah, 6 to 12 hours. So don't be in a hurry to leave hospital because you'll go home, no bleeding, and you die.
Doctor, you talk to the mothers in Alimba Labiakonga, but take about doctor pressure. Nzadde bulungi jagala gera, even the fathers, mukazi azadde bulungi momompi.
You will risk taking that mother home, nafuna bleeding, nafuna enafa. And yet that is something that can be managed in hospital by the trained people.
Yes.
Cut C-section, we normally keep you in hospital for at least 48 hours. Because the first 24 hours we are monitoring bleeding and other complications and controlling pain.
Yes.
The second day we want to see until you can do some things. So you can walk, you can eat well and all that. So that when you go back home, we are sure auntie, you are beyond that phase. The pain is controlled. You are able to do simple tasks. You can carry your baby and breastfeed. Then we can allow you home. Maybe at the end of the second day or in the third day. awone tugenda waka. So that is usually the duration of keeping in hospital.
So doctor, we have mothers ngomwana tasosa mutwe. Leta magulu.
Yes.
Then most of the doctors say agenda ku C-section. Mothers n'ababaliranye, like the next of kin, bagamba we've ever seen mothers abasindika normally ng'omwana era asoosa magulu. How is it?
So when giving birth, the preferred position of the baby is head first. Mutego gusookerawo ki wansi. Why? Nakugambye luli nti the head is the biggest part of the baby. So if the head can go through, the rest of the body can follow.
Yes.
So any other position from that is called a wrong position or a wrong malpositioning of the baby. Sometimes some babies are sideways transverse, waliwo babeera oblique, okay? Waliwo babeera nga omutwe guli waggulu n'ebigere bibiri wansi. Now breech, that is called breech. If the bum is down and the head is up, tugiyita breech presentation. Okay? Breech presentation is one of the complex positions of the babies during pregnancy. And it has been proven that it is linked with many risks to the baby.
To the baby, not to the mother.
Not to the mother, to the baby. The mother, for as long as she's okay, we are not worried. But to the baby, why? Because some breech babies start with one leg or two legs. So jukira twagamba nti olina otuuka 10 centimeters so that the head goes through. But if it is just one leg, even at 4 centimeters, the leg starts coming out. Yes. So if the leg comes out, it means that the other body will come and the head gets stuck. Because cervix never took 10 centimeters. If the head gets stuck, that baby is going to suffocate. Nafa. Or you will give birth to that baby ngakoye nnyo, cerebral palsy. Which take it. Now, it requires a lot of skill to deliver a breech delivery. So, and to be honest, even in the most skilled hands, sometimes breech delivery can be difficult. So most times, the doctors will advise you, because this baby is breech, it is safer to deliver this baby by C-section than going through labor. Jukira akagambo kali advise.
Kategeera. Nalabako mother ngaze okuzaala twins.
Yes.
Omu nga wa magulu.
Yes.
N'agaana ne bbaawe. Nga badokita tebalina kyakukola. But later when the doctors are out, n'asindika.
Yes.
And the babies are all out.
Yes. So it is possible. So the thing is, it's not impossible, but the risks.
Possible, but rarely.
It's actually possible. Sometimes when you come to hospital, already the labor process has started, and we think doing C-section is going to delay than breech delivery. Most times the doctors will do a breech delivery. Okay, but like I said, the training required for breech delivery, not very many possess it. Okay, so it requires you to be in really a center that can take care of that baby, gaina NICU. So that if the baby is not breathing well, again, that could NICU, you get it. Yeah, so that's why the doctors advise to go C-section. For twins, normally, if the first is the head first, we are likely to allow you to try and push that baby. But if the first baby is breech, we are not going to encourage you to push that baby because of the risks. Again, first baby comes out, usually the legs come, the head gets stuck. That means you've made it harder even for the second baby and all that.
So doctor, patient walemerako nagamba njabba sindika omuleka.
So now you have to assess if you have the skill to do a breech delivery.
It needs skill.
Like I said,
every guy can do it.
Well, it depends on how you're comfortable and how many you have done. Like these are not common things. Yes. You get it, eh? So if you have experience, and of course during the training as a guy, you're taught how to do a breech delivery. But there's you being taught, and then there's you actually doing them. So sometimes someone will be honest, nagamba, for me, much as I've been taught and this, I'm not very experienced to do breech delivery. So I would prefer you are in a place which maybe someone has better experience, so that your baby is not at risk. And that is also normal. To accept, to know that you're not well skilled in this area is okay. Instead of you attempting it and then someone gets an issue. But your doctor should be able to counsel you bulungi and you understand the risks that come with it. And sometimes we even ask you to consent into bakunyonyodde, you have understood, but you've insisted into jagala kusindika. And you, for whatever complications that come, you are going to take responsibility for that. So when you do that, they can give you the opportunity to what? To progress.
So Dr. No breech baby mumulaba before over
Yes.
complication e jawa na muleba.
That's why antenatal is important, because a breech presentation, every time ogenda mu ddwaliro musawo akwata mu lubuto si kyo. Akeberako n'alaba nti kale omutwe guli wansi oba akyuse. So examination is one of the ways we can tell into the baby has turned or early breech presentation. Number 2, scans. Era we advise ng'oli kumpi third trimester ngwa 37 weeks 38 beera ng'okozeeko kaka scan. Don't fear the scans. Do a scan. That scan will tell us. That is one of the most important things from that scan. Position your baby and presentation. Are you breech? Are you head first? Okay. So those are important things that we get from that scan.
Okay. So abazaala babayita batya kasowoole be baana abasoosa amagulu. Dokita agambye bw'aba asooseza magulu, they will advise us the hospital bw'ogaana bakuwa no consentinga. Naye nga kiri riski eri omwana si eri maama. So doctor, as we wrap up, waliwo bamaama amazzi ne gayiika for like a full week. Nga tamanyi oba geggo nga gajja matini. So kati wafunira contractions agenda otuuka nga amazzi gamuggwako naye nga tamanyi because yagalabanga nga tegali mangi kumbe ate ge gali ag'omwana. So ntegeera nti gano ge mazzi g'omwana wadde gajja matini. So I need to go to the hospital.
First is that oba oliawo and something has happened to you nga toli sure agenda ku ddwaliro. That's the best advice I can tell you. Oliawo mwana tomuwulidde bulungi, tasambye bulungi. Don't wait to say kansoke ninde mu if toli sure genda ku ddwaliro. Okay, so the most important thing is if you notice something atari normal, go to hospital. Number 2, most times amazzi gali clear.
Yes.
Okay, so you may find that maybe you are lying in bed, nozukanga akokali, that area is wet. Or you have sat down, oyambade kaleso wakatetei, you stand up and that your dress, that area is soiled, and you're sure that you have not passed urine.
Yes.
Okay, so if you're confident that your bladder is strong, you have not passed urine, you're seeing a discharge, you're not sure, sokera ku ddwaliro. Because most times the doctor agenda kebera, asobola kebera cervix n'alaba oba amazzi gayiika. Number 2, asobola kola scan n'alaba level y'amazzi. Because waliwo level gye tugamba nti kino kiri normal. Okay, usually the what we call the volume, the amniotic fluid index or amniotic fluid volume level ebeera between 8 up to 25. So if we see it is below 8, then we know that maybe the water has been pouring out. Most importantly, totally sure some discharge, sokera ku ddwaliro. Let them be the ones to confirm for you. Instead of you waiting, it can say, okay, ninde. By the time you come, you find the water has reduced, and that water is not that much. If it reduces, baby abeera mu risk. The delivering process becomes difficult, and most likely they can advise you to have a C-section. And yet if you went early, they could give you an opportunity okusindika mwana.
Okay, doctor, how about urinary leakage? Many women, especially after childbirth, leak urine. When they laugh or jump, is this something that they just have to live with, or are there effective treatments?
Yes. So during labor, one of the things that the hormones during pregnancy, one of the things that the hormones of pregnancy do is relax some of the sphincters of the body. They can relax the sphincters of the stomach, or heartburn. They can relax the sphincters of the urethra. Then you find sometimes urine leaks, sphincters of the anus. Sometimes you're not able to control. So some of those happen. So naturally, after giving birth, the hormones are not there. We expect your body to reset itself. The resetting process to go back to normal takes about 6 weeks to about 6 months for you to really reset. Yeah. Takes time. Some of course may go beyond 6 months, but that's usually the duration of resetting. So it is the advices. For example, there are certain exercises we advise mothers to do. Jebaita Kegel exercises. The Kegel are exercises to strengthen the sphincters of the urinary system. There is anal sphincters. Yeah, and the physiotherapist will advise you on what to do. But you can read about Kegel exercises. You just, if you're urinating, you're advised to hold the urine abruptly. Kusiba urine when you're urinating. So when you do that, it sort of strengthens those muscles. Then there are also some exercises you can do to help improve the strength of the muscles of the perineum. So what are exercises that we advise? Okay. Now that is different from fistula. Fistula. Fistula means you are in labor. No lwayo nyo in labor. So there's what we call obstructed labor or prolonged labor. Kubanga when this baby is coming out, omutwe gwa mwana abeera nga nyiga the structures nearby, so it can press the bladder. Now pressing even rectum. So if that baby takes long there, that area, if someone presses you for a long time, you feel some pain there. Yes. And if it's too much pressure, you can even get a wound there. Okay? So that is what happens with that labor. If the labor takes long, and those cells are very tiny, if the head presses long against the bladder, as well as now that area is already damaged, no funa opening evira bladder paka wansi. So that opening is called a fistula. So those are women who they have given birth, but the urine is just leaking. Okay? So, or if it has pressed nyo mugundi mu rectum, sobola funa fistula mu anal area. Tiine stool esobola kuyitira mu vagina.
So kino ekirala urine leakage koseka mbwe man nina kyenkolo bansesa.
That is different. You see fistula. Yeah, but it's when you have that urine, first come to the doctor. Doctor will take history. Na kebera bulungi nagamba nenda eno si fistula. This is because of maybe just the pregnancy effects. Because if it is fistula, it's managed differently. There are special doctors for fistulas who can operate and repair that area. After some time, then you recover. You get it, yeah.
Okay. So, Dr. Tumuleze nnyo leero katumuleke agenda akoleko atamatidde osobola okuteekamu comment yo Dr. ajja kubeera ng'aziddamu next Tuesday. So, buli kimu ndowooza kiri sorted. Producer Wabi, Doctor, do you have anything that you want to tell mothers about labor?
Yep. Yeah, but I think most importantly is just prepare. When you're pregnant, labor is better when you've prepared for it. Okay? And part of preparing for labor is having a plan, what we call a birth plan. Where are you going to give birth from? Kawempe, go and see Kawempe where they give birth from and all that. If you want TMR, come to TMR. Okay? If you want Nakasero and all these other hospitals, go there. Okay? Know the place, know the costs, what it requires to deliver from there, know the services that they give. So have a birth plan. Number 2 is that you should have a team. Be in a place that you're comfortable. Okay? Comfortable means that you see the faces that you've seen before. Sometimes labor is tough. You've never seen the faces. People are shouting at you. Those days, so many years ago, the Wasawas would give slaps. And these days, they don't.
Not here. I'll tell you where they give slaps.
These days,
you push and you're crying.
These days, they don't give slaps. But number 3, take charge of your labor and delivery by knowing what is happening, by asking the right questions. And remember, the most important thing of the pregnancy is go home with a healthy baby and a healthy mother. Okay? Sometimes it does not matter how you give birth, Kastango, in a healthy baby. Okay? Because you may insist in the kusindika, mwana afuna cerebral palsy, and then that's a different thing altogether. So the most important thing is you have a healthy baby and a healthy mother. Healthy mother means that your doctor has assessed all the risks, has managed you, okay? And you've given birth and you recovered from the pregnancy and you go and do other things. Come back again another time. So healthy baby, healthy mother should be the message for you.
Okay. So, musibe bulungi mwelaba.
Kale.
Executive Media. Focus, innovate, succeed.